This is TC Doolan. I am with the Blue Shield of California Foundation, and on behalf of our organization, I wanted to welcome you all to this two-day convening. So excited for the conversation, and I wanted to ask your forbearance because I am the parent of a 17-year-old, and I watch a lot of action movies against my will. And just as context, I will say, this time it's personal. The work of this policy scan and Build Healthy Places Network is really close to my heart. I worked for the National Coalition for Asian Pacific American Community Development for 5 years, and being able to bring together sectors, especially health and community development, is something that I value, that is part of my life's work. And to have an actual policy scan to bring that together with a lens on equity just feels like the icing on the cake and my life's work actually envisioned. So I'm so excited that I get to be part of this, that we get to support this. And we're thrilled to launch the Healthy Neighborhood Investments Policy Scan and Strategy Map. This is a particularly critical time for this work. It's an opportune moment for policy as we move into post-COVID recovery, and exciting because the Biden administration is literally name-checking multi-sector collaboration as a tool for recovery. So we are excited that the administration is committing to health and equity in our communities, and at this national moment, it's a particularly important policy window for us to make sure the resources and the allocations are community-driven and reflective of lived experiences and equity. We know there's significant interest across the country and across sectors in advancing policy, particularly for racial equity, and a specific interest in multi-sector collaboration. We are seeing this in our work and across the nation, and we at Blue Shield of California particularly value this. Our foundation is committed to a just and equitable world, and we're excited for this convening to establish that collective vision together, as well as grapple the ways that we can come together as a community and cross-sector leaders to operationalize that vision. And particularly for this policy scan, I don't just see it as a policy scan, I see it as an invitation to a party. I see it as we should all party together and enjoy and reap the benefits of systemic change in our partnerships, our relationships, and our operationalizing of equity. So I am so glad to be a part of this. I'm so glad that we get to support it at Blue Shield of California. And I wanted to hand it off to Zachary Travis, who will also welcome us from Build Healthy Places Network.
Well, thank you so much for that, TC. And on behalf of Build Healthy Places Network, I welcome everyone to this convening. My name is Zachary Travis, and we are all so excited to host this two-day event to seed cross-sector dialogue centered around policy change. At Build Healthy Places Network, we know this is a critical moment to build more equitable policy and to tackle racist and exclusionary policies and practices that continue to perpetuate health disparities. Earlier this year, we released the Healthy Neighborhood Investments Policy Scan, and I've heard from many of you about the value of this report to frame holistic cross-sector approaches to policy change aimed at accelerating racial equity. We're excited to hear all of this interest from the report. We see our role not only in this convening, but also moving forward as a convener to seed continued conversation and collaboration across sectors, and we are excited to open a space for further dialogue during this convening. The audience we invited is wide, as we believe the utility of the policy scan is broad and diverse. We truly hope that the next 2 days are fruitful for new connections and new ideas for policy change. And I'll hand it off to Jen.
Great. Thanks so much, Zachary. Hi, everyone. Welcome. My name is Jen Lewis Walden, and I'd like to welcome you all here on behalf of Shift Health Accelerator. At Shift, we work to simplify access to resources for community leaders advancing health and racial equity. I want to echo my colleagues' sentiments and excitement to launch this two-day convening. When we were developing the policy scan, we set out to create a vision for future policy built upon cross-sector strengths and partnerships that will accelerate racial equity. We also set out to highlight exemplars from the field and ideas to help all of us think about creative, multidimensional cross-sector policy opportunities. And we hope that the scan is helpful to all of your work and to the field at large. We're excited to be a convener for this dialogue and partnership with Build Healthy Places Network. While the scan identifies policies at federal, state, and local levels, we understand that the how of policy change is complex. It's a long-term endeavor and will take leaders from across sectors advocating for holistic approaches. That's why we're here today and tomorrow, and we're thrilled to have you join us. I'm going to turn it over to Bobby and Renee to dive into the scan.
Great, thank you so much, Jen. I am working on pulling up the PowerPoint now. Thank you everybody for joining us. Take just a moment. Appreciate your patience with this technical difficulty right now. Aha, here we are. Well, thank you everyone. We're so excited you're here, and welcome again to the Healthy Neighborhood Investments Policy Scan, policy convening for advancing racial and health equity. And Bobby and I will be giving a little introduction of the scan itself. In this project, we partnered with Shift Health Accelerator, and we were supported by the Blue Shield of California Foundation. Thank you all for your support, without which we can do this project. Also, I wanted to appreciate the input and guidance of our Policy Council members throughout the entire process. So first, we wanted to start off with the goals and intentions of the policy scan. So really the policy scan, what it is, it identifies policy actions at the federal, state, and local level for advancing health and racial equity through cross-sector investments. And it serves as a tool and a resource for community-owned priority setting that reduces inequities and strengthens neighborhood revitalization. And how we got here to this point is we looked at this team of ours, looked at hundreds of policies. We conducted key and format interviews and 3 rounds of review, which were advised by a 38-member policy council. In the policy council, folks represented community and policy advocates in the fields of public health, federal and state public policy, community and economic development, and healthcare systems. And we essentially asked these experts and practitioners a simple question, or maybe it's a complicated question. Which local, state, and federal policies can best lead to investments in healthy neighborhoods in ways that advance health equity, racial equity, and well-being? And what the policy scan does is it looks at policy change holistically. It frames pathways and opportunities for leaders to advance policy change and advocate for policy change. It identifies policy barriers and ways to overcome them for joint investments that address those social determinants of health. It identifies policies to create more conducive environments for collaboration across those sectors. We also wanted to ensure that we were centering anti-racism and equitable recovery throughout the entire process. And this scan acknowledges that this work is part of a much larger effort, and we're stepping into legacies of oppression, legacies of power, and legacies of resistance that have been a part of this foundation of our country and a part of our laws and policies and systems. The policy scan incentivizes healthcare to move from addressing social needs, such as diabetes management for someone who is unsheltered or doesn't have a permanent home, to more upstream factors like changing the policies and systems in order to address homelessness, protect residents, and preserve and produce affordable housing. And those are just an example of some of the ways that we uplift policies throughout the policy scan. We used the Thriving Together Springboard for Equitable Recovery and Resilience. And this was created by the Wellbeing Trust and CDC Foundation to serve as our fundamental framework for the policy scan. As I mentioned before, the policy scan serves as a broad compendium of federal, state, and local policies and tools for multiple sectors to take action. So essentially, we organized over 50 policy strategies and actions by these vital conditions you see here, that being belonging and civic muscle, thriving in a natural world, basic needs for health and safety, humane housing, meaningful work and wealth, lifelong learning, and reliable transportation. So we essentially operationalized the Springboard framework specific to policy change, meaning that we connected this framework to real people in real places that took policy actions. So you too can see the great work that's happening and be a part of advancing health and racial equity, so that we can collectively strengthen the vital conditions for everyone to thrive without exceptions. So some of the key takeaways from this process really that we found was it all starts with belonging and civic muscle. And good policy does not just happen and is not a substitute for good process. I'm really excited for our speakers to explore and share with us some of their insights starting with belonging and civic muscle. Secondly, policy is everyone's business. And there are a lot of opportunities right now to engage on the federal level, state level, local level, across sectors, depending on where you're at. Third, multi-sector partnerships have more power and perspective than they know. And they're able to see the landscape, the policy ecosystem, right, in order to make certain policy changes that advance health equity and racial equity. And lastly, we want you and others and everyone on the call today to consider this work as a resource and to consider Shift Health Accelerator and Build Healthy Places Network as support to build your own local policy maps in order to achieve racial and health equity. And with that, I'm going to toss it to Bobby Cochran to lead us into the cross-cutting themes. Bobby?
Yeah, thanks so much, Renee. I really appreciate it. Hey, everybody, it's so good to be here. I'm Bobby. I'm with Shift Health Accelerator, so I get to work with Jen and a bunch of our folks really working to move money from dumb stuff to better stuff. And a big part of that better stuff is community-led work to advance racial and health equity. And so for us, with the policy scan, we tried to make it both a reference document and a resource, as well as a bit of a roadmap. And also recognizing that whether you're in Riverside or Redding, California, or Rochester, New York, like each of us kind of march to the beat of our own drummer. That's totally cool. But we can each engage in policy, Renee, just like you mentioned. These were some of the cross-cutting themes that our policy council really lifted up. That ubiquitously everyone said you really need to lean into belonging and civic muscle to start with, but looking at growing incomes, looking at good supportive housing, a whole bunch of different things are key to moving forward. But we didn't want to just leave with kind of high-level strategies. So next slide, we really wanted to provide the ability to dive in more deeply. And so we did that in two ways. One was providing this concept of a treasure map that, if you're trying to do universal basic income in Stockton, California, or you're working to do citywide racial equity components into a citywide master plan in Rancho Cucamonga, that we want you to start with civic muscle and belonging, but if you take that and go into climate change and resilience, or you take it and go into housing, or you take it and go into wealth generation, we don't care which path you follow. Ultimately, all of these things are important. They're all important to community. And so in the scan itself, we actually provide some process guidance that are grounded in healing. Renee, you mentioned that process is just as important as the content. We heard that time and again. So every step we're taking as part of building policy, if we're promoting healing, that's really key. The other piece that we did is we didn't just stop at kind of high-level strategies. We said, well, reforming campaign finance is super important. Okay, who's actually doing that? Well, you've got the Matching Funds program in Los Angeles. You got the Seattle Democracy Voucher Program. You got California's Fair Political Practices Commission, Arizona Clean Elections Program. You have all sorts of different programs that we cite to and dig in deep on a couple of case studies, and we provide you links so that if you wanted to adopt a policy from Stockton, you could actually go into the code and website and lift that and use it for Birmingham, Alabama. So we provide all of that level of detail. And if you want, we can play a fun game in chat, which is say, hey, did you think about this kind of policy? And then we can play a game and say, hey, on page 20, section 4.15, here are the 5 things that we thought about. Or, oh crap, we didn't do that. Let's work together on version 2 because the policy opportunities are huge right now. So with that, next slide. We wanted to try and lift up a poll just to kind of get a sense of, after you've heard Renee and I talk, maybe you've had a chance to look at the policy scan already. How likely would you be to use this in your own work, your own community, your own state? Oh, heck yeah, I'm going to use it. Very likely, or no, that's the dumbest thing I've ever heard. I'm very unlikely to use it. So take a moment, go ahead and fill out the poll, and we'll share some of these results later on as part of our report. So we'll take about 30 seconds to do that. Go ahead and fill out the poll. And thank you so much. And with that, Doug, I'm going to hand it off to you to kind of lead into the panel and dig into belonging and civic muscle some more.
Great. Well, thank you, Bobby and Renee, and the rest of the team. Excited to be here. Excited all of you are joining us. Because of this panel, I found myself in my closet finding this thing called a blazer jacket. It was covered in dust. I dusted it off. Whether I'm using my suit pants or shorts, no one will know. So we are here. My name is Doug Judy. I'm the Executive Director of the Build Healthy Places Network. So I just want to welcome you all. I'm a pediatrician by training, and my years of working with children in hospitals and in clinics has always brought a certain urgency to this work. There are real children out there, and every year, every month that we don't achieve these policy changes results in them being born into or continuing to live in a world that doesn't support them. I was also a population health researcher and professor at UC Berkeley for many years and did health disparities research. And so I've also dug really deep in the data into where the inequities are, what populations, who and how these differences appear across populations. And what's really exciting to me is that what used to be a fairly narrow academic endeavor 20 years ago when I started that work is now mainstream. We think about disparities, inequities, inequalities all the time. And this conversation is really getting at those questions. What can we do about it? So before we start on a panel, I do want to thank again everyone who's put the work into this effort. So I want to thank my BHPN team for all of their hard work and really helping the Build Healthy Places Network sit at the intersection of multiple sectors, including policy, which has not been our work up till now. Policy plays such a critical role in deepening the types of equity and focused investments that we want to see in communities. So our team was led by Colleen Flynn, who you've not met yet, Renee Bedruzeman, Zachary Travis, who you have, and behind the scenes, we've got Ashley Hernandez, Ruth Thomas Squantz, and Laura Copado, who are playing an important role in the communications and outreach. It's also been a huge pleasure getting to know and work with our colleagues at Shift Health Accelerator. So Jen Lewis Walden and Bobby Cochran. Their organization is aligned with ours in vision and values, and we're excited to have them help with our moderation and facilitation today and tomorrow. And of course, I also want to thank Blue Shield of California Foundation, both for their funding and for their encouragement of us to take on this project. It really was a joint decision with the foundation to focus on policy. And TC Duong has provided unflagging support for us as our program officer. So thank you for that. So now I can invite, or I can welcome our 3 esteemed guests to the convening. You'll soon find that all of them have a unique perspective to offer as we think about the collective vision for policies aimed at advancing racial and health equity. We'll share their full biographies in the chat. So right now, I just want to briefly mention their names and places of work so that we can get onto the conversation. So first, the esteemed Angela Glover Blackwell, well-known founder and residence now of PolicyLink. We have Kathleen Kelly-Janis, Senior Advisor on Social Innovation at the Office of Governor Gavin Newsom, and Carolyn Wang Kong, who's Chief Program Officer for the Blue Shield of California Foundation. So I want to thank all of you for joining us. I'm going to start with a number of questions, but I do encourage this to be a conversation. So if you have something to add to another person's comments, please do. And if all goes well, we should have time at the end for questions from the audience. So we do have, you should be able to see on the bottom of your Zoom, a Q&A function. So you can put questions in there. We'll be tracking those. And if there's a particular person you'd like to have answer the question first, perhaps, you can put their name in all caps to focus that for us. So thank you all, and let's get started. So I'm going to start with a broad question for the three of you to provide a foundation for our audience to better understand the perspective that you're bringing. So could each of you describe for us the organization where you're based and the work that you do there? And from that point of view, how do you see the role of policy in creating a more equitable society? So why don't we start with you, Angela?
Hello, everybody. I am so pleased to be a part of this panel and so excited about the policy scan, and the presentation was really uplifting. Can't wait to dive into it even more than I have. I'm happy to start. PolicyLink is a national institute advancing racial and economic equity by lifting up what works. We started 23 years ago with what seemed like wild ideas and huge aspirations at the time, that we actually could begin to have a full conversation about how do we build a society that we all want to be in. And we called that equity, and we realized that so much of the progress that had been made in the decades before, often through the courts to try to build a more inclusive society, was actually thwarted by our development pattern. That we got access through the courts to good schools and jobs with a declaration that it was illegal to discriminate against people based on race. And that progress was thwarted by the suburbanization of America that was moving schools and political clout and jobs and housing in neighborhoods that were real communities of opportunity away from people who really now thought they had access to those things. So we began to talk about the fact that we needed to really combine the development process and our advocacy around it with our quest for racial and social justice. And we called that regional equity. In the course of doing that, we just kept deepening the conversation, deepening it to realize and understand, how did we get here? How did our policies around transportation and school building and school funding and all of that lead us in this direction to that we were at a point that where you live became a proxy for opportunity. And that conversation took us into many different arenas. And so when I say that PolicyLink is an organization advancing racial and economic equity by lifting up what works, what I'm actually saying is the organization felt that only through policy could we create foundation and platforms that we could stand on. And the content of that policy had to be informed by history, had to be informed by aspirations, and had to be grounded in the wisdom, voice, and experience of people who were working for change in their local communities. That's why we say by lifting up what works. Because the people who are in communities, both experiencing the impact of all the wrong things that had happened, and people in communities who were bringing their vision, their imagination every day to providing services, to organizing community, to building power, to running elections. There's the wisdom for the future that we need. So that's what PolicyLink has been about. I led the organization for 20 years and have now moved back into the position of being an employee. As the founder in residence, I'm doing a podcast called Radical Imagination, which I'll talk about as this goes on. It's what we need to achieve what we want in the future. But Michael McAfee, who is now the CEO of PolicyLink, has taken the conversation that I just described to the next level of situating it right in this extraordinary moment to talk about winning on equity. And that is what PolicyLink is all about now. Not just talking about it, not just creating demand around it, not just lifting up what works and wishing it were the rule rather than the exception, but winning on equity.
Great. Thank you so much, Angela. And really, thank you so much for being here today. It's a great way to start the afternoon. Well, again, afternoon for me, sorry. Kathleen, you are the Senior Advisor on Social Innovation, a position I didn't even know existed in the governor's office. So can you tell us about your work, the position or the role there, and how it all relates to policy?
Absolutely. Thank you so much for having me today. I'm Kathleen Kelly-Janis. I'm the Senior Advisor on Social Innovation to Governor Newsom, where I lead public-private partnerships for our office. This is a new role, and I think really a testament to the governor's belief in innovation and the possibility of bringing new ideas and new ways of addressing policy to solve old problems. And so just building on Angela's point about community and the importance of community, I knew in starting this role that community was going to be critical in order to not only be a source of good ideas, but to be a partner in advancing those good ideas. So I had the privilege, when we still could travel and get outside of the office, of spending the first 6 months in my role getting out into communities in California. I traveled border to border, visited 16 cities, met with 80 organizations, over 750 nonprofit leaders, foundation leaders, policymakers. And what I learned in that journey is that innovation isn't just about the tech titans of Silicon Valley or the entertainment moguls of Los Angeles. Innovation exists in every single community across our state, that communities know the solutions to the problems that they're facing. And while each community is different, every community that I visited and spoke with was really hungry for that level of partnership. And so that journey has really been the lens through which I have approached all of our social innovation work in the governor's office. I had no idea at the time what we were in for with this pandemic, but it really laid the foundation to be able to advance partnerships really like never before. During this last 2 years, we have launched 29 public-private partnerships totaling nearly $4 billion in addressing everything from housing and homelessness to cash assistance for undocumented immigrants to helping people find jobs. And the success of those partnerships would not have been possible but for the partnership of nonprofit leaders, community leaders, foundation leaders, and business leaders throughout the state. So as I think about how policy can advance equity, one of the key principles that I bring to this work is that we cannot advance policy without community. And in my role, I feel very fortunate to help be that conduit to engaging community in the policy making and implementation in Sacramento, which ultimately creates better outcomes.
Great. Thanks so much, Kathleen. And I'll point out to the audience as well that although we do have a California emphasis, the policy scan is absolutely national, and our funder, who we'll come to next, is based in California. So there is an emphasis there, but as many of you have probably already seen, there are policies, federal, state, and local policies in all parts of the country. They're both applicable to California and applicable to, I think, all of you. I've seen on the chat box, we've had people from Hawaii, the East Coast. So yeah, we've got a good range. So Carolyn, I want to give you a chance to tell us about your work at the Blue Shield California Foundation. And again, just thank you for encouraging us to take this policy direction. It's been a long-term interest for us, but without your support and funding to do this comprehensive scan, we just wouldn't have got here. So please, Carolyn, let us know about your work and the focus of Blue Shield on policy.
Sure. Thank you, Doug. And thanks so much to the Build Healthy Places team and the Shift Health Accelerator team. It's so exciting to see this come together and to be able to share out the amazing work of the scan. So Blue Shield of California Foundation, we're a statewide health funder here in California, and our dual mission is around making California the healthiest state in the nation and also ending domestic violence. And so those are our two key issues. We've been working on those two key issues for well over a decade. And like many of you, we know that health outcomes are really driven by factors outside of the doctor's office. Similarly with domestic violence, we know that domestic violence isn't just about a moment of harm between two people, but it's actually an outcome of, more often than not, a lifetime of stressors, individual, family, community stressors with lasting impacts to health and well-being. And so those two issues are big, they're big issues. We haven't solved them yet. And part of the reason is because we know that they're influenced by so many drivers outside of the health and DB sectors. And so our work has actually really focused on taking a multi-sector frame. We know that in order to influence those issues, we have to engage the sectors that actually influence those determinants of health and can address the root causes of them. So over the past 5 years, we've funded lots of different multi-sector collaborative models. The California Accountable Communities for Health Initiative, CACHI, the Build Health Challenge, Communities Lifting Communities, and of course, Build Healthy Places as well. We've also taken multi-sector collaboration as a model and applied it to domestic violence prevention, bringing different stakeholders together to work across sectors on domestic violence prevention. And so for us, when we think about our investment in multi-sector collaboratives is about driving equitable policy. Policies, we feel like policy is really a representation of our values as a society. Policy can uphold structural racism or undo it. And policies define where we put our resources. And so given that we focus on health and domestic violence, we know that communities of color suffer more health inequity, suffer more domestic violence because of structural inequities. And we've named things like economic inequity, racial and ethnic inequity, and gender inequity as root causes around which we want to focus our work. So the other thing that we're recognizing is despite the fact that communities of color are disproportionately impacted, they're also under-resourced to heal and recover from poor health or domestic violence. And so that's where policy comes into play, right? Because we know that when you actually engage folks with lived experience, folks that are most impacted, you're going to get to better solutions. And so we feel like it's the critical piece of this is how do we determine where we put resources? We bring the multi-sector work together with an equity perspective to prioritize voices of communities so that they can actually shape not just the policy, but actually the implementation as well. So our role as a funder has been really about funding collaboratives so that they can bring that equity perspective to policy. And that's where TC leads a lot of our work related to collaboration.
Great. Thank you so much, Carolyn. I have to admit, I'm getting sort of outsized pleasure watching folks put in where they're based. So I know we just had Nebraska show up and Spokane, Maryland, Denver. So we've got a really national audience here. And I think I mentioned earlier, I'm in New York City, so I'm on this coast. And the national interest, I think, is really important. Here at the network, we've been around for heading on 8 years now. And when I first started this work, it really was just simply about introducing healthcare to community development and community development finance folks. They simply didn't know one another. And the community development finance folks who were clearly investing in the social determinants of health weren't thinking in those terms, weren't thinking in that language around health. They tended to think of healthcare, clinics, but they, I will say, came around faster than any group of people. My medical colleagues have been much slower, honestly, to really grasp the importance of neighborhood and place than our community development colleagues. And so the real growing interest and in partnerships, not just knowing about each other, but partnering. Community development is really looking to make their investments in housing and infrastructure bigger, faster, and more impactful through partnership with healthcare. And healthcare is really looking to community development to partner and leverage the resources and expertise in the community and expertise in finance to have greater impact on the social determinants that have felt untouchable at some level. As a physician, I used to think of neighborhood as just a risk factor that you had or didn't have. But now we talk about changing neighborhoods for the better, making them as positive for the families that live there as possible. And so policy is really critical to that. And so that's really our focus today, because you have to have policy that can create a supportive environment for these types of partnerships to exist. So we heard from Renee and Bobby about the vital conditions and specifically belonging and civic muscle that really rose to the top in multiple ways, as playing an outsized role, really as serving as a foundation for tackling the other vital conditions. And so we're going to start with that theme, and I'm going to come back to you, Angela. So with that in mind, the importance of that, what does civic muscle or community power and belonging mean to you? And how might we think about these foundational concepts as we commit to a goal of achieving greater health and racial equity?
A lot of words thrown together there that come in different places along the continuum of change. Let me take civic muscle first. Civic muscle for me is just another way to talk about power that is authentic and grounded. You gotta modify power, because power can come from lots of different places and show up in lots of different ways. That we have learned that to make authentic, sustainable change that moves the needle, it must be informed by those who know the most about their lives. That the idea of just standing off on the side, no matter how well-meaning your heart, and saying, oh, I think this would fix it, and having the power to be able to move on your idea has done a lot of harm, because we may be well-meaning, but we are not informed about what's really going to make a difference. To really make a difference, the people who understand what their lives need, and the advocates and organizers who have been working with them to help to disaggregate the feelings and the insights, to put them within the context of where are the levers. All of that has to be able to have the ability to exercise the power to move on what is known. And so when you talk about muscle, I think that's a good word, because you have to build up the muscle, one, to be powerful, but also to be in the habit. You know, your muscles are really strong when they are in the habit of being called upon. And so to get in the habit of knowing that your insights are important, the habit of putting your stuff on the table, the habit of demanding to be heard, the habit of influencing those people who have power in different arenas to listen to you and to respond to you. Building up that civic muscle, building up that grounded power is absolutely essential for what we need. But you also threw belonging in there. And belonging comes in many different ways. When I think of belonging, I actually think of the end goal. I mean, the word belonging and the thoughts around belonging and the feelings really are a place of relaxation. At last, I am home. At last, this is as much mine as it is yours. At last, my voice and my presence are welcome and needed. That's the end goal. We all want one day to be in a place where everybody belongs. But belonging is also a small step, because in order to be able to tap that power that I was just talking about, people need to be in settings where they know they belong. And so creating spaces where people feel they can bring their best, that's belonging with a small b. You know, you just got to start there. But also don't forget that ultimately, when we have achieved racial equity, when we have built a society in which all can participate, prosper, and reach their full potential, that is the work of getting to a place where we belong. So I think it's important to separate those things out, and to also understand that all of our work is now challenged by the racist history of the nation that we live in. That nothing that you find in community just happened. It didn't just happen because the people there didn't have aspirations for a good life. It didn't just happen because people made some bad decisions along the way. It is in the DNA of the nation. And we're going to have to talk about it. We're going to have to understand where it has left us, the vulnerability that we have as a nation because of it. And we're going to have to go through the grown zone of acknowledging the harm and removing the barriers so that we can get to the other side. There's a lot that we're going to have to do in there. I hope we'll come back and talk about it. Thank you for asking.
We will definitely come back and talk about it. So yeah, a lot of just amazing thoughts in there. And I particularly just like the flexing the civic muscle and relaxing. Who doesn't want to relax and belong? Carolyn, let's turn to you. So what innovations are you seeing in the philanthropic sector related to deepening commitments to civic muscle and belonging?
Yeah, thank you. I'm so glad we're talking about this topic because I think for funders, you know, we have historically funded civic engagement in really discrete ways. It might have been around like voter engagement or census outreach. And that's largely because of the funder culture. We can count those things, right? We can see like more voters turned out. We can see the higher census population counts. And what we've seen less focus on is funding belonging as a path to power building. I just love what Angela just said around this. These words do represent a continuum. And I think for us as a funder, we're just starting to understand that continuum and how these pieces link together. For folks in the audience that are health people, you know, one thing that I'll just say is another way to think about belonging is social cohesion, social connectedness, right? Feeling like you're part of something. And we know in the health space that that's actually a protective factor to enable health. And we also know that a lack of belonging or othering can actually have really harmful effects to communities that can manifest as lack of opportunity, marginalization, oppression. All of those things are actually toxic to health and well-being. And so as I think about the innovations that I want to share, there's three that I'll focus in on very quickly. And the first is funding, organizing, and power building at scale. The second is funding belonging at scale. And then the third is applying a health frame to civic engagement and belonging work. So when I talk about funding, organizing, and power building at scale, I'm going to reference Angela a lot because I'm grateful for her wisdom. But Angela talked about building up the habit of being called upon. And one of the things that we've realized is that definitely is a long game investment for funders. Organizing takes time because it's built on trust and relationships. Organizing also takes time because communities don't always agree on what their priorities are. And we know this from our work in domestic violence, trying to organize people around not just gender justice, but racial justice. When we get to those intersections, it does become harder. But one example is our funding around census. And I mentioned it was often a discrete investment. A lot of times every 10 years, we'll fund census infrastructure and then we'll disband it, right? And one of the things that we've learned that I think is an innovation is through one of the many public-private partnerships that Kathleen mentioned. Funders across California dedicated about $25 million to census outreach. And what that did was created a really sophisticated infrastructure, a really sophisticated ground game of trusted messengers who could actually mobilize deep and wide in a state as big as California. And now what we're seeing is that, you know, we don't need to disband that infrastructure. We actually want to keep it going and apply it to other things, right? And so we've seen census tables in Inland Empire now being used to help with vaccine equity and outreach. Census Legacies is an organization who we've started to work with, and they're all about helping census tables repurpose themselves so that historically undercounted communities can stay and keep working on that habit of being called upon. So yesterday it was census, today it's vaccines, tomorrow it could be any whole host of things, of issues that are relevant for community. And so that's what we mean by funding, power, and organizing at scale. Funding belonging at scale. Again, I'm super excited that this is a topic on the webinar because we've come to really realize, and it's articulated in the policy scan too, how fundamental belonging is, not only to supporting feelings of agency and civic engagement, but really bridging across difference. And so there's a couple of things we've funded. UC Berkeley's Othering and Belonging Institute, and we funded them to actually help understand belief systems in specific parts of California so that we could develop narrative strategies that would shift those beliefs to influence policy. The important learning for us there, who sets the narrative defines what is possible, right? Who sets the narrative defines what is possible. And so it's important for us to be able to really systematically understand the beliefs that are underlying those narratives and change them in order to achieve equitable policy. The other example I have to bring into this picture is Pico California. Pico California is another organization. We've funded them to host Belong circles up and down the state of California. Most of them have been virtual because of COVID, but those circles are all about bringing people together across difference towards a narrative of shared health. And what's powerful here, Reverend Ben McBride is famous for this. He'll say, you know, the question is not what do we need to do? The question is who do we need to become, right? And when you shift that question, you're automatically going to the headspace of what's our shared vision and how do I see myself in that? It automatically fosters that sense of belonging and we're in it together. And so these are important and pretty concrete things that I think if we're thinking about what we can do in belonging to see the through line to power building. The last piece is applying a health frame to this work. And, you know, we have found as we've supported collaboratives that we want to engage other sectors, but we also want health to speak up on other issues because we know that when we apply a health frame, it can be unifying. People care about health and they really respect the health sector. And so when health partners speak up to advocate for issues that are perceived to be outside of health, folks listen. And so in this case, it's not just about bringing your resources necessarily. Sometimes it's about bringing your voice. Sometimes it's about bringing your data too, because you health folks, we have a lot of great data about communities. And so we've seen this with lots of our different investments, multi-sectoral investments, particularly related to housing. And with the Build Health Challenge site of the Vallejo Housing Justice Coalition, they were, if folks recall, they were the first city to pass an eviction moratorium under COVID. That didn't happen by accident. That happened because of a cross-sector collaboration that was in place, including health at the table, advocating for these types of wins. So those are just three quick ones, and happy to talk more about them as we move through the program.
Great, thank you, Carolyn. And I do really like the quote, not what should we do, it's who we should become. I want to note to folks as well that there's a fairly active chatter going on in the chat, which is really great. And so we're posting some of the links. Carolyn mentioned a number of great examples that we're posting links about those there, and there's folks posting with each other. And so please do continue doing that. And remember, for questions, put the questions in the Q&A box down at the bottom. So Kathleen, you've got the state government perspective. So what role do you see for partnerships between philanthropy, private sector, public sector, and the public sector institutions in thinking about and strengthening this belonging and civic muscle idea?
Well, partnerships are my jam, as you might imagine. So I truly believe that what we've seen in California firsthand is that strong community partnerships are not only key to the success of policy initiatives, but they're also really key to fostering this empowerment and this community belonging that we're talking about today. And I want to dive in a little bit deeper on the example of census that Carolyn raised, because I really believe that the 2020 census has laid the foundation in this moment that none of us expected to really, I think, catalyze and catapult community-based empowerment and engagement in policymaking like we've never seen before. And so, as Carolyn mentioned, in California, we brought a data-centered approach that prioritized hard-to-count communities, which are also disproportionately impacted communities by health measures. And so with a state as big and diverse as California, we knew that community partnership would be key, that we couldn't in Sacramento manage a census count without the partnership of communities. So our legislature invested over $130 million. That was in partnership with Philanthropic, with the $25 million that Carolyn mentioned, in regional community administrators throughout the state, and hundreds of local CBOs. So, for example, we had invested in promotoras who were health workers in the Latino communities, or other community organizers who were going door to door. And literally during this time when the governor was on the one hand saying, no abra la puerta, like there was all of these threats of deportation, we were also saying, oh, but please do actually answer the door if it's a census worker, because we need you to fill out your census. Those messages were confusing, and being able to have that trust of community was key in order to be able to lift up the voices of those who've been historically marginalized in our state and ensure that they too were counted when it came to the 2020 census. And so as a result of the census data that was recently released, one of the statistics that we feel really proud about is that California surpassed our 2010 self-response rate, especially in hard to count tracts of California. It had a higher rate of response than all of the other larger states in the nation. And so that means that we will have better data to be able to inform policy decisions that would have for communities that would have otherwise been missed. It's a really, really exciting outcome that we feel really proud about and couldn't have happened without public-private partnership. And this data will inform decisions about representation, about funding, about policies, schools, businesses. That is power. That's the essence of community powers, and that's what it looks like in practice. As Carolyn said, this infrastructure that we developed during census, just right about the time when vaccines were proven safe and effective for distribution, was about the same time we were winding down the 2020 census. And so it was this incredible story of being able to tap into this network, this infrastructure and communities. The same hard to count communities that we were trying to reach in census were the same communities that we were trying to reach with our vaccination efforts in order to ensure that they had access to the vaccine. And so we've worked with philanthropic partners like the Sierra Health Foundation, Public Health Institute, California Community Foundation, to ensure that we are not only tapping into these CBOs and these leaders, but actually paying them for their time and for their efforts. Community-based leaders need to be funded. They can't just volunteer their time to go door to door to do community outreach. And so an example of this is the Leadership Council for Justice and Accountability in Fresno, Lanier. They helped connect rural farm workers with vaccines by doing door-to-door canvassing, by doing phone calls in community bilingual support to register them for vaccinations and reduce barriers to participation. And efforts like these are playing out all over the state. We have a faith-based outreach program that is also engaging faith-based institutions, which is another way to foster that belonging. And so we don't claim to have it all figured out here in California, but what we do know is that when it comes to community engagement, we need to be working together if we want to achieve equity. And so as we get closer to the end of this pandemic, we need to be thinking about what's next. How do we tap into this network and engage this network, and not just invite community leaders to our tables, but set new tables and ask communities to invite us to their tables to ensure that communities are developing on this infrastructure when it comes to housing and jobs and racial equity and all of the other challenges that we face.
Super, thanks so much, Kathleen. And I think the census example is such a good one. That's real civic muscle. And if I remember correctly, I saw that they were expecting California to lose 2 seats, and we only lost 1. And this is real life work. And there's a couple other states that will remain unnamed that did not gain an extra seat that might have. So, and they tended to ignore the census. And so it was really playing out here and getting the communities engaged. So I want to also just pull us back to the actual policy scan before we move to another round of questions. In fact, Ashley on my team, maybe you can link it again in the chat box. But just to sort of put all these great examples in some context, the section on belonging and civic muscle is on page 20. It's actually page 33 of the PDF, but page 20. If you glance at that while we're continuing the conversation, I'll give you a sense of how the whole report is laid out and the level of detail and utility that you can get out of it. So I'm actually going to stick with you, Kathleen, for another question, which is really in thinking about our post-pandemic recovery at the state level. What is the vision for equity and social innovation for California?
Well, as Governor Newsom always says, equity is our North Star in California. For me, that means that social innovation is going to be key to ensure that we are testing out new ideas to achieve equitable outcomes. Another thing that the governor always likes to say is, so goes California, so goes the nation. That is, as we think about innovation in California, we also think about how can we be on the edge of the cutting edge of public policy in a way that we can test out new ideas and draw on the strength, the innovative strength of our state. So one example of that we feel really proud of is the Immigrant Resilience Fund. So right around the time when the CARES Act was passed, at the very early stages of the pandemic, there were, of course, stimulus relief for Americans. Undocumented communities were not included in that stimulus. And 1 in 10 Californian workers is undocumented. 1 in 2 children in our state has an immigrant parent. So we knew in California, the governor was committed to ensuring that we were also providing the much needed cash assistance to these undocumented communities who were really, especially at that time, on the front lines of our pandemic response, making sure that we could have food on our tables and that we were had care for our elderly Californians. So, and not just because of that, but undocumented immigrants pay $2.3 billion in taxes in our state. And so to us, the idea that they would not also be included in that CARES relief was a form of indignity to these communities. So we worked with grant makers concerned with immigrants and refugees to stand up a $150 million cash assistance fund in just a couple of weeks. And we were successful in distributing cash assistance to 200,000 undocumented families in the state. That fund, which was seeded thanks to an early gift from Blue Shield of California Foundation, allowed for deep coordination to ensure that we were working together with the state. We were literally on call saying, okay, California Department of Social Services, you're funding these organizations. Philanthropy, you can fund these organizations. And this model was ultimately replicated in dozens of cities and states throughout the country. It was a model to show what bringing dignity to undocumented communities and affording them the dignity of cash assistance looked like. But it was also replicated in the policy initiatives of the governor's recent budget. Whether it is expanding the earned income tax credit to ITIN holders, many of whom are undocumented, and providing cash assistance through EITC, or whether it's the new fund that we have developed to support unaccompanied minors who are coming to this country and transitioning into our society in California, and making sure that we are wrapping them up and providing a new model for welcoming Californians. This is, we believe, that the kind of innovation that can see deeper policy change for broader equitable outcomes.
Doug, if I might weigh in.
Oh, please.
I just thank you so much for all of that, Kathleen. There's so much to be proud of. that California is really leading on. And when the governor talks about equity being the North Star, that is not just empty rhetoric. I just wanted to expand on what Kathleen was saying and talk about what is going on right now. That as states are opening up, getting rid of the mask all across the country, California is waiting. And California is waiting because we have built that civic muscle. We have power at the community level in California, and it is heard. And it is heard even if it doesn't speak. Dr. Mark Ghali, who is the head of health for California, is thinking about the communities that have been made most vulnerable through so many policies in the past with every decision that gets made. And Kristen Urquiza is the person who started Marked by COVID. And you have probably seen her on television. Her father died from COVID, and she was interviewed a lot because she said her father's only pre-existing condition was believing what President Trump was saying. So she got a lot of attention, and she started this organization. Today, in a publication that PolicyLink puts out called COVID Race and the Revolution, it comes out every Wednesday. It will come out today. You can find it on the PolicyLink website. She has an essay. And the essay is about the fact that there's so much conversation about people who are reluctant to get the vaccine and not enough conversation about the people often in the Latinx community who cannot access it. She cites what's going on in the Black community, but she really goes deep into what's happening in Latinx communities all across this country. And she lifts up California as an example of waiting, saying, yes, a lot of people have been vaccinated, but a lot of people have not. And we're just opening it up, and we need to wait. That is an example of that power just being part of the DNA of the decision makers as they think about a problem is not solved unless we have solved it from the point of view of those who are most targeted, marginalized, discriminated against, and made vulnerable. Only then do we have sustainable change that we can stand on and expect as we go forward. California is doing some things that are right and getting a lot of pushback for it as we become a nation where we have so much diversity. The challenge for the nation is to develop a true multiracial democracy where all voices matter and are heard. And I think when we say, so goes California, so goes the nation, I am hoping that we can build a multiracial democracy in California because the nation needs a model of one.
It's really great. Thank you, Angela. And yeah, sitting here in New York, it can be easy to make fun of California. And I'm always telling people to never underestimate California. Carolyn, our next question was around multi-sector collaboratives. What do you see the role is for them in advancing racial equity through policy change?
Yeah, so I'm going to answer this question with a story about a story that actually is about my hometown, East San Jose, and I'm going to talk about the East San Jose Peace Partnership, which is a catchy site. So East San Jose is a community of 3 zip codes. And it's a very, very diverse community. 175,000 residents living in 3 little zip codes there. Actually, they're not so small. And it's home to a large Latinx community, large Vietnamese community. In 2016, a number of smaller collaboratives, all focused on community violence, came together to form the Peace Partnership, which I have to read it because it stands for Prevention Efforts Advance Community Equity. So a new coalition that was formed in 2016, and they became a accountable community for health site here in California with the goal to actually build on the work of the smaller collaboratives, which is also something worth mentioning. Sort of when these smaller collaboratives come together, there's definitely a strength in numbers and a strength in systems change when you're able to unify under a bigger umbrella. So they did that so that they could actually focus on the root causes of community violence and trauma. And so this collaborative, to me, it stands out as an example of what's possible with racial equity, because from the very beginning, they named equitable opportunity as a key outcome of the collaborative, but they broke that down to not just mean we want to see decreased violence in our communities. They actually named that they wanted to see increased resiliency and increased social capital in that community. They named things like changing social norms, making sure that families were supported and connected, making sure that community wealth and resources were growing. So they got very specific in tying equitable opportunity to community conditions, to health. So they focused on the what very clearly from the outset and named equity. The other big takeaway from this collaborative is the how, right? It's how they actually operationalized equity. And so this collaborative, and this is a risk when collaboratives come together and grow in size and maturity, is that equity can get lost. But what they did was, for their whole collaborative was co-chaired by a systems person and a resident, and they modeled that structure with all of their work groups. And so there was definitely partnership in modeling racial equity by sharing governance between system and residents. They also then defined a set of criteria that were equity focused, that drove every decision and every intervention that the collaborative actually pursued. And for us, we've been invested in multi-sector collaboration for a long time, lots of different types. And I think what's really compelling too is, when things are sticking, when the structures and the processes remain despite transitions, right? People can come and go in and out of these collaboratives. And there's been some fluctuations, but these things have stuck. So I feel like that's very, very compelling. So in terms of, what does this example tell us then about what the potential is about collaboratives and how they can advance racial equity through policy change? I mean, there's three things, right? The first thing is that, name equity as the price of admission, just like this collaborative did, right? You're going to come on board. These are the things that we're going to align around. The great thing about that is it's not just about committing then you commit the collaborative to building your capacity around racial equity, but it also, each of the individual partners have to build their own capacity, and they bring that to their home organizations. And so you end up getting a bigger effect as well. The second thing is really that, Renee mentioned at the top of the session about how collaboratives see the ecosystem. And so really this is about the fact that collaboratives know that individuals don't live their lives in silos. They see the different forces at play in our lives. And so they can actually address structural inequities from multiple domains and multiple sectors at the same time. This is very important because one of the hardest parts of being a collaborative is aligning interests and making sure that your interests are not pitted against one another, right? And so if you can actually see the whole ecosystem, you can align and advocate for issues, budgets, solutions that really do see the benefit of the whole. And then the last piece is really around modeling what it means to operationalize equity. And this is something that's been a really keen interest area for us, is how do you, especially as collaboratives get larger and more sophisticated, how do you make sure that you don't lose sight of equity? How do you not become almost so corporatized in your structure that you lose sight of what the collaborative is about? And so we've seen that collaboratives that really effectively operationalize equity in their governance, how they make decisions, how they share power, those are the ones that actually have the trust of communities, and those are the ones that often have an ear to the ground. And so those are the three things I would say that we've observed from all of our investments as really critical ways that collaboratives can push for equitable policy.
Great, thank you, Carolyn. And then we did have a follow-up question in terms of, equity is the right thing to do, and multi-sector collaboratives, I think, are the right thing to do, but that's not always enough of an argument to make the case. So what is the value proposition? I hesitate to say return on investment, but what's the value in addition to it being the right thing to do, which can help us achieve equity and support these collaboratives?
Yeah, and so there was a question in the chat too, I think, about how do you maintain ongoing engagement for power building, and I think that's one of the key things with collaboratives is we've seen, because we've been in this space for some time, as many folks on the call too, we've actually seen collaboratives move further upstream the longer and more mature the longer they do their work and the more mature they get. And so that is a huge benefit, because then they start to develop the infrastructure to tackle bigger and more complex issues. So going back to the peace partnership example, they originally focused on community violence, and where that took them in their work over time was focusing actually on things like displacement, gentrification, neighborhood livability. They actually formed an anti-displacement work group that consisted of residents and CBO or community-based organizations and housing advocates. And that work group has been working very closely with the city of San Jose and their anti-displacement strategy team and their policy team. And last October, they actually issued, so this work group actually issued recommendations that the city adopted around gentrification and displacement, right? And so that's a huge win in terms of why we need to continue to sustain these collaboratives, because as they get deeper in their work, they will go more upstream, and they can have much bigger impact on the things that'll drive health. I'll also mention, I think this collaborative, as well as many other catchy sites during the pandemic, played critical roles, right? Part of our hypothesis as a funder in funding collaboratives is that they're building to address multiple issues in community. Once you build the relationships and the infrastructure, the hope is that they actually can pivot to address lots of different issues in community. And I think we saw that time and time again during this pandemic. The Peace Partnership has been instrumental in helping the Department of Public Health reach linguistically isolated communities deep in East San Jose. They helped bring vaccine sites to the places where they knew residents would go in East San Jose using data. They also raised money for undocumented families, and have also been part of the anti-eviction discussions at the city level. And so that's the value that we see, is that we feel like they can play different roles, and quickly, as evidenced by the pandemic as well.
Oh, great, thank you. And sticking to that point, Angela, I wanted to come back to you. What do you see as the power of these multi-sector collaboratives? So groups that contain members that wouldn't normally be working together. What is their strength in your eyes for advancing policy change to focus on ending racial inequities?
They have an important contribution to make along the full continuum. Jeff Canada, Harlem Children's Zone, back in the day, they were very instrumental in getting us all to see that if you bring people together and make sure that they are explicit about what their contribution is going to be toward a very explicit outcome, you have a much deeper, more meaningful collaboration. It's one thing to pull people together and say, wouldn't it be good if we work together, because we all care about solving this problem. It is another to say, wouldn't it be great if all the children in this community could go to college? And what can you do to make sure that that happens? And how much of it are you willing to do? And are you willing to be held accountable? And we're going to critique you if you're not doing your part. And if you can't deliver, you can't be in it. That's a whole different level of collaboration that has to do with, this is your work, that part of how you measure whether or not you are of value has to do with, is anybody's life better? And if so, how and how much? So we move from let's work together to let's work together explicitly to solve a problem. Where we need to go is we need to take that, that capacity that we now have, and we need to engage in transformative solidarity. We all know that this is a moment like none other. None of us have ever seen an opportunity in this nation to be able to do something truly transformative that has at its center dealing with the issues of race, which predate the founding of the nation in terms of being the conundrum for the nation. This is an amazing moment. We can't tinker. Therefore, we need to make sure that we're paying attention to all of the elements, all of the would-be collaborators, all of those who might come together. What's in it for you? We have to begin to translate it. Wouldn't it be good to do that? This is essential for you. There is a competitive advantage for racial equity that the business community needs to understand. Government needs to understand that unless we build and deliver on a multiracial democracy, the future of the nation is not bright. And people in community know that this will not happen authentically and sustainably if the civil society is not in there pushing. So we've got to be able to do that work. The collaborations that are happening are essential for the goals that we have set for ourselves. And we can see that we can't deal with the housing crisis or the health crisis or the transportation crisis or the education crisis or the water crisis if we don't all come together and put in our pieces. But we also have to build on this habit that we're starting to form to be able to do something transformative. Because if we let this moment pass without significant transformation, shame on us.
No, that's really powerful. And I really appreciate your focusing on not on the collaboration itself, but on the goals of the collaboration, because it's very easy to get caught up in the process and identifying what the outcome is, and then bringing those together and seeing whether they really can achieve that is incredibly important. Whether that's getting every child ready for kindergarten or every child ready for college, as you said, is a really powerful, it's subtle, but a really important distinction. So we have about 10 minutes left in our schedule, and we've got two last questions that are really for all three of you. So I want to, and so we'll want to keep our answers reasonably short, but I'm going to open this up. So the first is really, what do you see as the accelerators of policy change at the federal, state, and local levels? So I'm going to open up to three of you, and whoever has some thoughts. Accelerators.
Well, I'll jump in. I'm just reflecting on the conversation that we've had so far, and I recently read the book of our Lieutenant Governor Eleni Kounalakis, who was the ambassador to Hungary, and it was so inspiring reading about how she was really trying to help build up civil society, this very, very small group of organizations that were trying to hold democracy accountable in this very new democracy. And it gave me a really deep appreciation for, wow, we've really got so much going for us here in America, and our civil society is so robust. And I think we've given so many examples of great collaborations and innovations and community empowerment, but we're not there yet by far. And I just wanted to give an example of one case where I think we still need to build on is on the digital divide. And I know this is something Angela was very involved in with our Jobs and Economy Recovery Task Force. 1 in 5 California students didn't have access to the digital resources that they needed early on in the pandemic. And so we launched an effort to make sure that we were getting devices to those students. It was a philanthropic effort, ultimately funded by the state, a $5.3 billion investment. So really this opportunity to truly bridge the digital divide for students in California like never before. This is a moment to really accelerate change, as you're saying, Doug, that we have not seen before. And yet, as Angela knows, because we did some of this work, those devices cannot be leveraged by students or by their entire families without supports at the community level to ensure that there is also digital literacy. And there are very few organizations. One good example is an organization called Street Code working in East Palo Alto that is not just supporting students, but supporting multi-general approach to bridging the digital divide. We need more organizations like that, and we need to help identify what are the issues of the future and how do we help build the next generation of civil society to ensure that we are truly taking advantage of this moment to accelerate social change and build a more equitable society.
Yeah, thank you, Kathleen. And coincidentally, I was the primary care pediatrician in East Palo Alto right after residency. So used to work in that little burg. Carolyn and Angela, thoughts about accelerators for policy change?
I just wanted to add a couple of quick ones. One thing that accelerates is measurable progress. We really need to tell the story of what we're doing. We need to measure it, and people need to know it. You shouldn't have to be in a foundation or a university to know about it. Everybody needs to know about it. The next thing that accelerates progress is a narrative about the future in which everybody can see themselves. We need to tell ourselves an exciting, inviting story about what the future will be if we lean in and invest in this moment and get it right. Equity is not a zero-sum game, and we need to stop acting as if it is. The next thing is to really begin to champion full inclusion. Champion full inclusion, championing belonging, championing these things by having every institution that exists make this a priority and be driven by it. That once we get to that point, we will start going forward, and not to be afraid of the pushback. Don't get all caught up in the pushback. Of course, there's going to be pushback because things are about to change. But those who are most resistant will benefit from the change. Just make the change, and we will see that people will come along and stop just slowing down to try to get everybody on board.
Great, thank you. Carolyn.
I would just really emphasize the narrative change piece. I think for us, changing hearts and minds, we've realized is really foundational to getting people's mindsets to shift. And and I agree, it's not just about equity or not equity, it's about understanding the complexity of how these different issues are actually tied together and do impact all of us, right? And so telling that story and narratives that bridge people and issues. The other piece that I will just say is we've talked a bit about data. We've talked about the importance of disaggregated, and I'm going to add contextualized data. This is mentioned in the scan as well. It's Asian American Heritage Month, so I cannot not say this in the skin that I live in, disaggregate the data, okay? Because if we just even think about the COVID experience, Pacific Islanders have a worlds apart experience with COVID than Asian Americans, right? And so it's so important to not perpetuate the invisibilities of how different issues are impacting our communities. The other thing about contextualizing data, this is something that I've been thinking a lot about with our team, is every time we show a bar chart or a pie chart with race ethnicity about a certain issue, we are taking an opportunity to tell a story about a community, and we're often not a part of that community. And so it's really important for us, especially, and multi-sector collaboratives are a great forum for this, to check the data with folks who are actually most impacted, to contextualize the data so that we're not actually promoting negative or false narratives through that data, that we have the full picture. The last piece is an investment in this continuum of belonging and power building. And we've talked a lot in our foundation about building leaderful ecosystems, especially as we moved to this model of investing in more collaboratives. We really do need to make sure that collaboratives are supported with being able to distribute leadership, build power, focus on belonging as a key entry point to building that power pipeline. Kathy Cha at Haas Jr. always reminds me that alliances are not built in the moments of crisis. They have to be cultivated over time, and the fruit is picked in the moment of crisis, right? And so that's the groundswell that we need to build towards in this moment.
I was thinking about flexing civic muscle and picking fruit. This is all really great. And you guys are really building on each other really beautifully. I think the storytelling that Angela mentioned is so important. Carolyn, you help put in context, because data helps that, but you can mess it up if you don't understand the context for the data. So these all really build on one another. So a last question is really, it's a why now question. So before we turn to questions from the audience, and I do want to encourage folks to put questions into the Q&A box, and we'll see how many we can get to. Why now? Why is policy a critical lever now as we think about achieving racial and health equity at this moment in history?
Well, I think I've spoken to that. Why now? Because this is an amazing moment, and we can and must do some bold things. So much of what we feel bad about in terms of the people who are left behind and harmed by the decisions and policies that have existed in the past, we treat them as if they are anomalies, bugs, flaws in the policies, but they actually were features of the policies. We have so many systems and policies that were actually designed to keep people down, to keep them marginalized. And we have got to turn that on its head. That's why I spend so much time talking about radical imagination. This is the moment for our radical imaginations to be able to imagine outcomes that have never existed and create the systems and policies and strategies that will get us there. So bring your boldness. Don't get caught in what has been. It didn't serve us well. We need to do something different.
I think we're living an incredible moment because we truly believe in the value of working together. Interestingly, there was a position like mine that was initiated about 20 years ago. And this person who went into the role said, oh, we'd love to all work together with philanthropy and nonprofits. And the organization said, oh, no, you're government, you're the big bureaucracy. We're the nimble ones on the ground. You go do your work and we'll do ours. And now, you pick up the Stanford Social Innovation Review and all you read about is this policy, the collective impact and the systems change, and that we can't work in silos. We need to work together in order to address these really big issues that we're facing. And this is an incredible moment for that to come together because COVID has laid bare inequities in ways that are undeniable and in our society. And I feel really excited because it feels like there is momentum and there are resources being put behind this with the American Rescue Plan. Our governor just released a $100 billion comeback plan, which is focused with equity in the center. So if we can't do it now, then we can't ever do it. So we have to deliver.
Super, thanks. And, I just want to really thank all three of you for all of your amazing comments. And Carolyn, do you have a closing remark before we turn to questions?
Yeah, I just wanted to double down on both what Angela and Kathleen said. I think as we think about the American Rescue Plan and the California Comeback Plan, I read a quote recently. One of the things that we've been looking at are recovery and equity councils as we think about COVID. And there's this question of, which places are merely spending that money and which places are actually investing it. And I think that's the difference, that this is the moment about how do we actually invest in our communities for something that's different than what we had before. Kathleen talked earlier about Chromebooks and the digital divide. And I think what's been such an interesting symbol and signal of this time, I'm a parent of 2 school-aged kids, and we went from a place of, no technology or very little technology to Chromebooks for all, right? We went from a place of thinking about cash assistance as a handout to really realizing the importance of economic security and the relationship of that to health, and trusting that people would know where they needed to spend that money. And so I think for us, the important moment here is to not consider those things from the lens of a disaster mindset, right? Oh, we just did that for the pandemic. But think about them as pilots for spread and scale about what we want in a new normal, right? It worked. And it's in some ways it's worked beautifully. And so we need to take the time to understand those impacts and how to play them forward to something different.
Thanks, Carolyn. I'm Colleen Flynn with the Build Healthy Places Network, and I'm going to lead us into some question and answers. We've had a lot of questions come up from the participants, and thanks everyone for tuning in. This has been such a great, rich discussion. So one of the questions, and whoever wants to answer it can, is how else can the power of stories and strategic storytelling catalyze civic muscle and belonging? Would one of the speakers like to answer that question, or a couple?
One way is for people to get together and tell their stories together. That too often we don't know how much we have in common. California is a perfect example, but the whole nation is an example, that everybody has a story of how you happen to be here. Everybody has a story of family and community. We need to share those stories. And then we need to pull out of those stories what we have in common in terms of what we want, but what we have in common in terms of how we struggle. And that can take us to a place of joining together to be able to remove barriers and find ways to find the joy in really getting to know others and understanding how well we are connected.
I love that idea of finding the joy of how we're connected, Angela. Would anyone else like to speak up, Carolyn or Kathleen?
Yeah, I love the idea, Angela, you're raising of coming together, and it reminds me that sometimes these stories are actually not so joyful, and we also have to acknowledge the deep history of racism and genocide in our history if we're going to move past it in this country. One example of a way that we're doing that in California is through the Native American Truth and Healing Council, which we launched last year, and which we hope will be a model for truth and healing for not only the 109 federally recognized tribes in California, but for Native Americans across the country, and could also serve as models for truth and healing for other atrocities and injustices that have existed in our country's history.
Carolyn, do you have?
Yeah, I will just add, Colleen. I mean, I think we've really found that use of stories just helps people understand intersections in people's lives, but also intersections in issues. And particularly in our domestic violence work, folks think about domestic violence as a very private issue. And when we talk about what drives violence, and we talk about, a mother trying to keep herself safe, why don't women just leave, right? And talking about, the choices that she's making around housing security and her kids, the choices that she's making, or the forces that are at play in her life around financial security, that just helps people understand that it's not just up to domestic violence shelters to solve this issue, that there are actually financial stressors that are impacting, there are housing issues that are impacting this issue, community conditions. And so we've used story to broaden the tent and really engage other folks to care about this issue and understand the implications of not caring about this issue. So that's something that we've worked on a lot as a funder, and we've actually done some capacity building on this with our grantees too, to help them tell the story in this way as well.
I think that we're at a moment where we're talking about reparations because of storytelling. This moment where we've been focused on race has caused people to tell the story, not just of slavery and Jim Crow, but of the Great Migration and redlining and all of those things. Those stories help people to understand that we have to move forward in different ways.
I really agree with that point, Angela. So taking a little bit of a different angle, someone's asking, do you have any policy suggestions that have been successful in conservative states? This person said, our state legislator this year spent a significant amount of time discussing their displeasure with critical race theory that resulted in cuts of higher education institution and some misguided laws. This has resulted in some freezing and fears with advancing racial equity programs. Would anyone like to think about answering that question?
Well, I'll start. We've got to organize. We have to really do a lot more organizing and tell stories and build power and use it. We have to make sure that we're participating in the voting process. People need to understand that their votes make a difference. And they also need to know that this pushback is proof that we are going forward. I don't know how many of you read Time magazine. I don't, but I just happened to get one this week quite by accident. And the cover is Visioning Equity. It's a vision for equity. And the beautiful cover was done by a Black woman. She was commissioned to do the artwork. 25 pages are devoted to equity in it. And there's the last section is 40 ways to get there that includes a policy agenda that would create an amazing future. I was blown away. Even though there's pushback coming from conservative states and all of that, the country is moving in a new direction. We need to recognize this is where the wind is blowing. This is where we're going. We need to organize around it, build our power, vote, and just keep pushing. Nobody said this is going to be a cakewalk. It's going to be hard. There are going to be setbacks. We're going to have to struggle, but just keep going forward, keep expanding our numbers. Transformative solidarity is what we need now.
I don't think it was an accident you got that Time magazine. But I also just wanted to pick up on another thing you said earlier, Angela, about how this is not a zero-sum game. And I think there are a lot of people in our country who feel under threat right now. They feel that lifting up racial equity somehow brings them down, or I think, and I'm far from the expert on how to advance this in conservative states, but I do think there is something to be said for really putting out a new narrative around how we can all advance if we have a more equitable society, and that this is not a zero-sum game.
Heather McGee has a book about it, The Sum of Us. I encourage everyone to read it. I wrote an article about it called The Curb Cut Effect. You can find it on the PolicyLink website. There's broad conversation going on around this country, particularly with people who invest in narratives, trying to tell that story. The business community has latched onto it. They're talking about the business interest in racial equity. We are moving in that direction. I know it feels bad in places where the leadership is not with you, but this is the future. Keep pushing and joining.
Carolyn, did you want to add something? Yeah.
I mean, I think something that's much more tactical is the othering and belonging work. I would recommend folks check that out. I think that the depth of research that that they've done with us around belief systems, I think, is really critical, because then you get to, what are the concerns that people are feeling, right? And part of this is about bridging and seeking to understand across difference. And so that work, I would say, has been really helpful. We've done that work specifically in Orange County and Inland Empire because of specific belief systems that we're trying to see if we can impact around creating a bigger we, especially around economic mobility in those places. So I think that that's another concrete approach to try in terms of bridging and shifting the narrative.
Thanks, Carolyn. Another thought that I had too is that Build Healthy Places Network, we're trying to bridge the sectors of community development and healthcare. And a lot of times we think about jargon, there's a lot of jargon that's used. And so language really matters here too. And so one way to think about it is maybe the term equity may resonate, maybe it's fairness may resonate, opportunity. So really choosing your language when you're thinking about the audience that you're going up to talk to, I think is also an important point to bring up. I think we have time for one last question. And this one is particularly to you, Angela. You spoke of the competitive advantage of racial equity as an argument to be made to the business community. Can you elaborate on that a little bit for us?
That when you think about it, businesses really have a vested interest in advancing racial equity. With the demographic changes that are happening in this country and the demography of the world, it is clear that people of color really are the consumers of the future, and business can do well if they are able to participate. We also know that being able to figure out how to tap those markets, how to think not just about who you hire, certainly we need to do diversity in hiring, but the products and the services, they need to really be geared toward the people who are building community and building family. So there's that interest. But also, until we get equity right, there's not the workforce, they're not the communities that workers can live in, there's not a civil society that people can join, there's not a healthy, stable democracy that businesses can count on. So if you think about it, getting the racial equity agenda right really is good for business. There's a competitive advantage to doing business in an environment in which we have racial equity. And if you go on the PolicyLink website, there are about 12 different publications, a blueprint for CEOs, all kinds of things that make this point. I would encourage people to pursue it. It's just part of making sure that every sector is invited in, not just to get a special medal that you're doing racial equity, but to understand the hard work that you have to do in order to be part of moving the racial equity needle.
Thanks, Angela. Kathleen or Carolyn, any last thoughts on that topic?
Happy to let Angela have the last word.
Same.
Thank you so much. This is such a rich discussion and we're grateful for your time. So this closes this conversation and we hope that the conversation continues as we're talking about. There's so much national momentum. And thank you, speakers. Thank you, Kathleen. Thank you, Angela, and thank you, Carolyn.
My
Really
pleasure.
appreciate it.
Thank you for having us.
Thank you.
So everyone, I want to talk a little bit about what to expect for tomorrow, because this is a 2-day policy convening, and tomorrow we have some exciting sessions planned for you. One is that they're from 9 to 11 specific time, and 2, that we are organizing the day into 2 tracks for participants to deepen commitments to holistic policy change. Both will be largely discussion-based, aiming for new connections, ideas, and potential collaborations. And these discussions will be interactive, so participants will be broken up into small groups. The first track will help multi-sector collaboratives use the policy scan that we've created at local levels. The second track will focus on identifying California policy platform across organizations and leaders to collectively advance policy for holistic community health and racial equity. We are really excited to carry forward the vision we heard today and focus tomorrow on opening space to discuss the how. How can we collectively operationalize this vision in partnership? We have colleagues in the field already putting the policy scan to use and thinking creatively about the role policy change might play in their work. So excited for you all to participate tomorrow, and thank you for joining today. Now I'll ask a couple of our colleagues who are part of our policy scan for brief comments to get us thinking in advance of tomorrow's session. The first speaker is Bill Sadler from Public Health Alliance for Southern California. Bill, I'll turn it over to you.
Thanks, Colleen, and thanks everybody for attending today. This has been a great session. I'm with the Public Health Alliance of Southern California. We're a coalition of 10 local health departments in Southern California, everybody from Santa Barbara to San Diego out to San Bernardino. And we work with them on a variety of different public health, but also multi-sector initiatives that are advancing a lot of the things that have been talked about today. And one of the main things that we've created is called the Healthy Places Index. And this is a mapping and data platform that maps down to the census tract level within California, data on community conditions, including the social determinants of health. We have health outcomes. We have a lot of different data in this resource. And one of the ways that we're really tying to policy action is that we've actually created policy action guides tied to the data. So within our mapping tool, you can look at the indicators, say housing overcrowding or educational attainment or active commuting. And you can look at the policies that have been implemented across the nation that have been used to improve those conditions within communities. And so what we've done with the playbook is that we've started to look at a crosswalk of what we have, some of the policies that are already in our guides that are in the playbook as well, but also think about ways that we could be updating our guides to kind of build on what all the research and work that's been done as part of this effort. And so we really see this as a real opportunity for us to really be elevating a lot of these healthy communities ideas within our guides and tying it back to the data itself within our index.
Great, thanks, Bill. I'll turn it over to Deirdre from NFF, Nonprofit Finance Fund. Deirdre?
Hi, everyone, and thank you for inviting me to speak to you today. Such an inspiring few hours. I'm Deirdre Flynn. I'm from Nonprofit Finance Fund, which is a national nonprofit focused on lending and advising to nonprofits. We have been engaged in lots of efforts across the country supporting partnerships between community-based organizations and healthcare providers focused on addressing social determinants of health. And a lot of that work has focused on creating equitable and sustainable contracts. Finance in the name, where we always want to know how the money is flowing. I know we've all heard a lot over the years about contracts, particularly given the chronic underfunding, as we all know, of the social sector. We've worked one-on-one with organizations, meaning one CBO and one healthcare partner. We've also worked with networks of organizations trying to contract collectively with healthcare partners. And when entering these partnerships, both the CBOs and the healthcare partners express really good intentions, lots of kind of commitment to the work to address social determinants of health, improve health outcomes, and increase health equity. So they're all coming to this with, the best of intentions. The truth is, though, despite tons of time and resources and goodwill that both sides bring to the table and pour into these partnerships, there's still a long way to go to kind of advance health equity in the way that I know all of us on this call kind of really envision. So I don't think that contracting in this way and in the way that NFF has been working on it for the last few years will go away. But what we're really excited by are the conversations like we're hearing today, where we're seeing signs of organizations and communities building on their all of their assets and their people and their networks and their community-centered expertise to shift the policy landscape and shift what is possible in the local systems, kind of holding up the way we live today. And I think this work really goes far beyond the boundaries of one healthcare contract. So I think that, yes, to flexing the civic muscle, to distributing power, to listening to what communities have to say, again, everything we heard about today, we want all of that to be given the same star treatment that these contracts between healthcare organizations and community-based organizations have really been given, in the literature, in all the panels we've all been to kind of, for the last number of years. We really are excited about kind of lifting up these emerging stories of community-centered work, communities defining what they mean by health and communities acting on it together. And we think that the policy scan is a really important tool because all of that, all of what we hope for we can't get there without changes to policy and changes to the system. And I think this is a really terrific tool to kind of catalyze that conversation. So thank you for inviting me to share all that.
Thanks, Deirdre. Thanks for participating now and in the Policy Council to help inform the scan. I'm now going to turn it over to Wei-Yu Zhang from California Pan-Ethnic Health Network. Take it away, Wei-Yu.
Thanks. Hi, everyone. My name is Wei-Yu Zhang, and I'm the Community Advocacy Manager at the California Pan-Ethnic Health Network, CPAN. So thank you for having me today here, and it was a really great I hopped on a little late, but it was really great to see everyone, talk about these important issues. So CPAN, we're a nonprofit organization dedicated to improving health equity, racial equity for communities of color in California. And policy advocacy is really one of the main, theory of change for our organization, along with building people power through building coalition networks. So just to share an example of our community-driven policy work here. So in 2020, our organization published a brief called Centering Equity in Healthcare Delivery and Payment Reform, a guide for California's policymakers, excuse me. And it was a very long report focusing on a set of recommendations on the ways that the Department of Healthcare Services and medical, managed care plans can achieve greater health equity through processes like, payment reform. And so the report was a really collaborative process of making sure that the recommendations that we're making are reflecting communities of color's lived experience. And I was just one of the many staff at CPAN that work on the report, but one of the, the most fulfilling processes for me was really hosting these, day-long listening sessions across the state to really sit down, and this was pre-pandemic, sitting down with, community partners and community residents to make sure that we hear about their healthcare stories and we include that data in the, in the report. And of course, the same folks that we heard from through these focus groups, they also helped, directly shape the report by providing edits and input to the final draft. And then I think just one quick note, as someone that works in policy, but also do coalition building, I think that people often don't see the linkage between these very tedious like state processes like procurement and the linkage between that and what's really going to impact our health equity. And so there's so many opportunities for us to really participate in these processes and hold health plans accountable when they provide services for communities in California, right? And including, one opportunity coming up, which is medical procurement by DHCS in June. And so, our job at CPEN is really to make sure that there is a linkage between the lived experiences of communities and the decision-making that is happening at the state. So I'll share some links of the report and in the chat. And so thank you again for having me.
Thank you, Wei-Yu. It's great having you here with us. So we're about to wrap up. We might even wrap up a couple minutes early, which I'm sure everyone would be excited about. Again, we are excited to see you tomorrow. We thank all the speakers for participating today. A special shout out to Blue Shield of California Foundation for supporting this work, and our partner Shift Health Accelerator. We couldn't have done the scan and this convening without you and all of our Policy Council members. As wrap up, we're going to put up the poll that we did in the beginning about how likely you are to use a policy scan as a way to do some evaluation for us. So we'll put up the poll now and give you a couple minutes to respond. And I know some of the questions that weren't answered while you're putting your answer in asked about specific policy examples around environmental justice, around workforce. And so our scan does provide a lot of examples throughout that deal with some of those topics. So you could take a review. If you'd like to talk about it more, you can definitely get in touch with us. So now to complete our day together, we do have a short survey so we can understand your experience with the convening. So we'll put that link in the chat function for you all to respond to the survey quickly before we end. And we really appreciate you doing this because it also just serves to and helps us think about convenings in the future that we'd like to host. And again, thank you for joining us. Please tune in tomorrow at 9 a.m. And a big round of applause for all the speakers and participants. The chat has been just blowing up with comments and resources and people chatting with one another. We'll be sure to save that chat too and get a hold of some of you that we'd like to talk with directly as well to continue this policy work to advance health and racial equity and think about addressing social determinants of health. So with that, I will close us off. Thank you all and see you all tomorrow.